Good morning, everyone, and welcome to the third annual Your Global Future College and Career Fair. My name is Matthew Hughes. I'm the Executive Director of the International Relations Council in Kansas City, and it is a real treat to have all of you here. Things, as you can tell, look a little different, and my guess is that some of you have attended the College and Career Fair in the past. We miss seeing all of you. We miss seeing our businesses and universities and community organizations who love joining us for this event. We miss seeing the discoveries you make about your international academic and professional opportunities after high school, but we are so glad to welcome you here nonetheless. We're particularly grateful this year to our sponsors, Cerner and the University of Missouri. You'll get to hear from them through the course of the event. But my job here today is just to welcome you and introduce you a little bit to the International Relations Council. You may know that the IRC strengthens Kansas City's global perspective by maintaining an active dialogue around world events, global issues, and their impact on our community. As an important part of that, we love welcoming high school students so that you can explore the world from right here in the Kansas City area. We do offer a wide range of programming, and Natalie, if you wouldn't mind dropping our website in the chat, please. We encourage you to check out our website. There's a mailing list that you can sign up for, but I did want to highlight a couple programs that might be of interest. Many of you are following the election very closely. We're following it too from a foreign policy perspective. We are an apolitical, nonpartisan organization, but there are a number of foreign policy issues that are at play here in the election. And so we invite you to join us for the remaining sessions of our Choices Election Issues series. We also have a relatively new series called the Lexicon Language Introductions, which every week is going to give you an introduction to a different language from around the world. Super fun. We also have Friday International Career Series sessions. Right now we're looking at living and working abroad. So we hope that you join us for those on Fridays. But without further ado, it's now my pleasure to introduce our Education Outreach Coordinator, Vista, Natalie Friend. She has played a critical role this year in putting together this event, and we're so grateful for Natalie's contributions. Natalie will introduce you to some additional opportunities just for students and introduce our speaker for this morning. So Natalie, please take it away.
Hello, everyone. Thank you so much for joining us today. I hope that you are as excited for this event as I am. We at the IRC do have a wealth of other opportunities and resources, as Matthew mentioned, for students and teachers to take advantage of. I'll review these later today, but briefly, I do want to mention that we have our Academic World Quest Trivia Competition coming up next spring. It should be in its 15th year, which is a free and exciting opportunity for students to learn a bit more about the world around them in a competition sort of way, alongside the chance to win prizes and even the trip to go to DC for the national competition. We also have the Global Education Guide online. So if you are curious about an international career and you want more resources, we have it on our website. Please check it out. Teachers, we have curriculum resources as well. This year's Your Global Future is unlike any we've done before. A program in two parts, this live fair and digitally packaged set has an incredible range of both synchronous and asynchronous programming for students and teachers to take advantage of in order to expand your horizons and your classrooms. Thank you so much for joining us and for making it possible. That goes to both our student attendees and teachers today, alongside our exhibitors. I have a few housekeeping items before I pass the mic over to Brett Gaines from Cerner. Students, please remember to join each session today with a device that allows video, and keep your video on. This is your chance to practice your interview skills and to make a great impression. We do ask that you keep your microphone muted when you're not speaking, but don't be shy about unmuting yourself when there's a chance to ask questions. We hope you understand if we do need to mute your mic to avoid disruption. Check out each booth's mini page on the IRC website, which they are all linked from the event guide if you want to learn more about the organization and find access to resources. And after you've attended your last live session, please don't forget to complete your post-event feedback form. The link is available in the event guide under the Expectations and Helpful Hints section. If you're interested in winning a Google Nest Mini, please take a look at our activity and we can enter you in for a raffle drawing of our 3 prizes. So let's go ahead and get this show on the road. I'm happy to pass the mic over to Brett, and he is going to teach us a lot about Cerner and ways that we can and explore it internationally and everything else. So, Brett, you can go ahead and take it away.
Thanks, Natalie. Good morning, everyone. And I'm going to set myself up here, so hopefully I don't mess up any of the technology by sharing my screen. So give me 1 second. All right. So can everyone see that? I say, Natalie, I might need a confirmation from your end.
Looks great.
Perfect. All right. So, good morning, everyone. Thanks for having me. I really appreciate the opportunity to come and speak at this really great event. I'll be honest, before I say getting kind of assigned to work on this project, I had never really heard of the IRC before. So, after connecting with Natalie and doing a little bit of research on my own, it was really awesome to be able to see the impact and the thought process that goes into the work this organization does in helping Kansas City students and teachers and the local community really start to think about Kansas City in the context of a global atmosphere and how even our small place here in the Midwest can have a huge impact in places way beyond our reach. And so for Cerner, for those of you that don't know who we are, what we do, want to definitely take the time today to share a little bit about our past, who we are, why we're doing what we do, and then some of the impact that we have seen because of the success and the outreach that we've had. So, as Natalie said, my name is Brett. I am a recruiting partner within Cerner Corporation. I focus specifically on diversity, inclusion, and outreach work, partnering a lot with community organizations around Kansas City and other markets in the United States where we have a presence. So that's going to be the DC area, as well as the Malvern, Pennsylvania area. But for those of you who have probably seen one of our Cerner buildings before, who thought, what the heck is Cerner? What do they do? Why do they have so many locations? Give you a little context there. Cerner is a healthcare IT company. So when you think about that in the context of the healthcare space, whenever you've gone in to see a doctor, a nurse, if they've ever typed up notes, ordered prescriptions, write down notes, that software that they're using is probably going to be software that Cerner's provided or one of our competitors. And so what we really focus on is finding ways to eliminate paper out of the healthcare space and digitizing all information along that process. And over time, what we've done is changed. Our goals and vision has definitely altered, but at the core of Cerner is still that focus on the electronic medical record and making it as robust as possible. So with that being said, to give you a quick idea of maybe why a place like Cerner needs to exist in the first place. The state of healthcare, as we all know, especially in the United States, has a lot of challenges that we're still facing. It has definitely made a lot of progress, but there are a lot of challenges that we're facing in healthcare abroad and domestically. Some of the things that you might encounter is one, here in the States, healthcare is really expensive, as you probably know. 18% of the US GDP is spent on healthcare. So that means that Americans are spending a lot of money on healthcare. And abroad, that definitely isn't the same case. You notice that healthcare is going to be a lot much more affordable in some locations. So how do we kind of synchronize some of these ideas abroad and domestically? In some cases, this is a challenge within itself. And then how do we just kind of lower those costs or make it much more affordable? You're noticing that there's an aging population. So if your parents are like mine, which is a boomer, my mom just retired from the workforce after 40 years of work. And so she's living her life, her best life right now, enjoying those days at home. But that means that she's probably also going to start leveraging the healthcare system more as she continues to age. With this growing increase of people taking advantage of the healthcare system more, and you're noticing this shortage of doctors and physicians and clinicians, you're starting to see a supply and demand issue. So there's more people leveraging the healthcare system and less people to actually deliver the quality of care that we need. And that's big here in America, and that's kind of across the world. Outside of that, some general things you notice, even more broad and kind of continuous across the globe, is there's still this fragmentation within healthcare. So that means for some of you, it could mean you probably have had a doctor, so you may have had your pediatrician, and then as you grow up, you kind of switch over to maybe your primary care physician, a general practitioner. You then maybe go off to college, or you move on to another city and take on your next adventure in life, and then and work with a new doctor or a new location. Or maybe you have a medical concern that comes up, and then you start leveraging specialists within your care. All of these doctors are might be on different systems. So for you to get your information from one doctor to another is going to, in some cases, is a lot harder than it really needs to be. And so you notice this across the board. And sometimes you notice this even within the same hospital. You may have hard time getting all of your information from one part of the hospital to the next. And that shouldn't be the case. I always like to compare this example to every car has a vehicle identification number. And if you were to go to an auto body dealership or anything along those lines, you would notice that they can type in your VIN and be able to see the history of your vehicle. The question is, why can't we do that with our healthcare? Why isn't there one way that if I went to go to multiple physicians, they can pull up one record and see everything? And that doesn't exist today. Outside of that, even more so, you're still noticing that some places operate at a silo. You're noticing healthcare disparities. So depending on where you live in your country, if it's very affluent or has a lot of money invested in that community, your ease and access to healthcare is going to be much greater than someplace that maybe is rural or someplace that is maybe considered a low income or impoverished area. How do we create more equitable access to healthcare is another big concern. And so all of these challenges within healthcare continue to ask or state, why does a place like this why does Cerner need to exist? And we believe that one of the greatest ways we're able to do that is through technology. We've seen so much success and advances through technology in terms of how it's moved healthcare along, that we believe that we can still make those things happen today. And so that's one of the big things that we really look for within Cerner is kind of continue to advance our space as a healthcare information technology company and really solve a lot of the problems that are still coming forward today within healthcare. And so if you were to continue looking into Cerner, here's a couple of things about it. So our vision statement here, a seamless and connected world where everyone thrives. It's really kind of the underlying goal and what we're doing. And our mission is to relentlessly seek breakthrough innovation that will shape healthcare of tomorrow. And so those are the big underlying whys of what we do and why we continue to do what we do. Now, let's put this into a little bit more context and bring this a little bit more kind of home today. So Cerner as a whole, we are headquartered in Kansas City. We are a homegrown local business of 40 years. I say our three original founders started us out here in the Kansas City area, and we started working with hospitals in Oklahoma, actually was our very first one. And over time, we continued to grow and grow. And even once we took this more broadly, take this into an international market. And so as of today, we have over 27,000 associates. That's what we call ourselves as employees. We have 27,000 associates. About half of us are located in Kansas City, and we have probably another 8,000 or so associates working in the Kansas City markets, but then outside or in the United States markets, apologize. I said, but then outside of that, the rest of us are located across the globe. So we have offices in a lot of different places, and I'll cover that in one of the next slides here. But outside of that, we then also work with 5,900 hospitals. I say we have over 650,000 physician users and over 2.2 million non-physician users. And that again is all of our clients all across the globe. And say, as you can see there, we have 80 plus languages that are spoken for business, including the different dialects that we're in, and our Cerner Millennium solution. So when you look at Cerner products, Cerner Millennium is kind of like your Windows operating system. Cerner Millennium has been translated into 7 different languages to help in grow our global aspects there. So we are definitely seeing ourselves grow, and we've seen a lot of really great success within Cerner, but we've also taken away a lot of really great lessons learned and a lot of best practices that we can take from all of our clients to continue improving on the way healthcare is practiced and delivered. And so that last one there, if we have 500 plus patents worldwide, that is the largest amount of patents that any healthcare information technology company holds. And again, we try to do this abroad. So we encourage our associates to always be innovative, regardless of where they are, what they're doing. We want them to be able to continue disrupting the status quo. We want them to challenge what's going on in their space and share those ideas broadly. And if it's something new and innovative, get that thing patented as well. So lots of really great opportunities here. But in terms of our global presence, so as I said, we started out as a Kansas City company 40 years ago, and here we are today operating in over 35 countries. And so here you can see a list of all the places that we are actually doing business with today. So we've had to translate our solutions into multiple languages. We have whole teams in these areas. So you have consultants, you have your independent HR departments, you have software engineers, you have system engineers, you have all of these businesses and these associates working all across the globe to work and help ensure that our clients have the greatest access to the software that they're purchasing from us. And so our clients have seen really great successes, and they're able to have a far and ongoing outreach. And when we talk about doing business in these international spaces, what you find is that obviously, like for example, in the UK, where they have a national health system, that's going to operate very differently than how we do healthcare in the United States. And so what you're finding is that we not only have to do business there and we're trying to sell these products and we're trying to support our clients, but what we're really doing is also understanding the businesses and the markets that we're integrating into. So how does a government ran healthcare system vary or operate differently than the healthcare system in the United States, which is a little bit more privatized in some of those instances? What does it look like to integrate into those markets? What laws do you have to make sure that you're abiding by that might be more strict than what we have here in the United States? What languages are people operating in? What is the vernacular that's different? One of the easiest things you have to think about is the fact that a lot of countries are operating outside of the United States are operating in the metric system. So even our healthcare system does do that, but some cases we have to translate things into means that are definitely going to be much more heavily utilized in the markets that we're going into. So how do we adapt and think and serve in the span from that part of that culture or that region? And how do we ensure that we are being a great partner to our clients? So thinking about it from that aspect of influencing and being a part of that partnership and helping our clients to succeed in all aspects of their work, not only just in patient care, but also delivering in terms of legislation that might need to be passed, or integrating and understanding and helping their leadership within those foreign countries to understand the importance or significance of technology integration. And sharing, data sharing, and information that comes along in some of those spaces. So lots of great things that we're doing, not just within healthcare, but as we continue to grow and integrate into these different countries, thinking about it much more broadly in terms of what their needs are and making sure they're able to achieve a lot of those goals. So in terms of our associate presence, so as I mentioned, we have 27,000 plus associates. And so here's all the countries that our associates are working from today. And so we have we're kind of spread out across the globe, but like I said, most of our concentration is going to be in the United States, here, just still in your backyard of Kansas City, located at one of our locations across the metro here. So this last slide kind of points it out for you, give you a little bit more of a visual here. So the green dots is where we actually have employees. So associates are sitting in some of these different markets. The blue dots are the blue spaces, and the blue kind of areas are countries where Cerner products are contracted today. And so again, you see there's the world's pretty big, I say, and we are impacting a lot of different spaces here and having a lot of really great impact, and being able to understand and grow in these different markets has definitely helped us to broaden our thought process and to bring back some of those best practices. And so I always like to share some of the ways that we're able to do that today. And these are just a couple of client success stories from across the globe that have been able to do some really great things. And so, given the times that we're in, with it being, the world going through the first pandemic really since what we saw in the early 19th or 20th century, I say we're kind of experiencing everything brand new. And so when COVID really took off across the globe and the world started to make the major shift of shutting down, essentially, and you're noticing this major spike in COVID cases and people leveraging their hospital and their care systems more, when we found out, or when our clients were starting to see that they were becoming overrun, they were running out of hospital beds, a lot of places across the world had to set up temporary healthcare systems or help hospitals. And so specifically, this one example up here, we were able to help our client in London set up a 4,000 bed temporary hospital within about 2 to 3 days. Now, to give you context here, when we do a typical implementation of Cerner software at a client site, we typically take about anywhere from 18 months to 2 years in some cases. And sometimes it takes even longer, depending on how many sites we have to go live with, how big of a hospital and how many beds they're trying to service, how many physicians and clinical users there are. So for us to be able to stand a temporary hospital setting up in 2 to 3 business days is really, really hard and really impressive. And we got really great feedback. And we not only did this in London, we also set up temporary locations in Madrid, Dubai, Seattle, and New York City. So, right at the beginning of quarantine, our associates were incredibly busy working to make sure that patients across the globe had access to care and that physicians had the space to deliver the quality of care that they knew they could. And they needed access to these software system to track patient information, to be able to have access to all of this data, to know who's getting what and what's happening in the background. And so for us to be able to be a part of that was very significant. And again, drives home that kind of that reason why we do what we do. There was a major need and we were able to help be a part of that solution. For some of these other clients, you'll see kind of various things. If you're unsure or never heard of this, HIMSS is a metric there, or a way that we're able to see how successful a hospital is at actually going from paper to digitizing their electronic medical records. And so in this case, we were able to help our client become one of the first locations in Australia to receive HIMSS stage 7, which means that they've essentially eliminated any paper documentation in their clinical atmosphere and everything is digital. Um, Now, some of you may not have ever experienced this, but if you've ever seen a doctor's handwriting, um, chicken scratch is probably still too good to label some of that handwriting. Many doctors scribble, and when you write pen to paper and you're writing small numbers and lots of notes, mistakes can happen. And for a long time there, mistakes, clinical mistakes, and just reading the wrong thing on a record was the a leading cause for many problems within the healthcare system. And so when we're able to digitize things and put systems in place that can check and be like, are you sure you want that much of, or this high of a dosage of a drug? Or, hey, are you aware that these two drugs interact really bad with each other when integrated into a person's system? When you're able to do those types of things with software, it reduces the amount of mistakes and health issues that can arise. And so when we're able to help clients really achieve these goals and achieve a level of all digitization, really working not only from a healthcare space, from health intent, it makes a huge difference. I say in some of these other instances, you see Imperial College was able to reduce their time frame by 53.5% in terms of documentation. The more time that a doctor or a nurse can save when they're documenting things means they get to put more time back into the patient. Doctors and nurses aren't really big fans of documenting. So if we have a systems that can capture data as it happens. So if you're hooked up to sensors, have those sensors talk to your electronic medical record, and that does all the documentation for you. That means that a nurse or a doctor can actually spend more time with you and actually understanding what's bothering you rather than having to document everything. And even outside of some of those things, the one down here with the UAE ministry. So we were able to help improve the antimicrobial resistant bacteria tracking. So what we've seen from the electronic medical record and what we're seeing at Cerner is that we are moving from being a healthcare IT company to a healthcare intelligence company. And so the more that we can go in and use our systems and software to actually track and gather data and assimilate that information and then use it to make much more informed decisions, the quality of care a person receives goes up that much more. So when you're in the hospital setting, you're hopefully not only just getting treated for the problem today, but you're getting the best quality of care that you possibly can. And so when we're going in and helping our clients do these things with just a simple piece of software, so someone in an office either here in Kansas City or in an office in Dubai or in London sat down and wrote code that was able to not only gather information, but then to also start deciphering it through machine learning and artificial intelligence. We're able to start putting together these really advanced algorithms and tracking so that the quality of care continues to increase. And so with all of that, I'll wrap up with what our current CEO, Brent Schaefer, kind of said about Cerner and where we see ourselves going. So as we have for the past 4 decades, Cerner's technology and collaborative programs, along with the most respected providers, will lead a wave of disruptive innovation focused on making healthcare better. Really, that is our goal. We may be a software company, but our ultimate goal is to create the software that's really going to continue to drive the quality and the best experience that you may have when you go into a clinical setting. It is something that we're all going to use. It's something that a loved one of ours is always going to be tapping into. So we want to make sure that we're providing the best software possible. So that way, when you're going to the hospital, you're getting the best quality care possible. And we also want to use that to shape the way you think about healthcare. So if you're healthy today and you maybe haven't gone to the doctor in a while, might be time to schedule a physical. best time to go utilize healthcare is when you're healthy, because a doctor can always, their best goal is to try to keep you healthy. It's much easier to be proactive in your care than it is to be reactive. So as we continue to be a huge part of the healthcare industry by utilizing and leveraging technology to do so, we're also hoping to shape the way that people think about their healthcare, how they tap into their health, and integrating better practices along the way. So hopefully that gives you a really good idea of Cerner, what we do, some of our global outreach, and the impact that we have. Healthcare is not just a US thing, it is a global thing, and we definitely see ourselves as global partners to everyone that we work with. And as we continue to grow and hopefully be successful, we hope to see some maybe your faces joining us here in the near future. So I will turn it back over to Natalie for next steps. But thank you so much again for this really great opportunity, and look forward to seeing some of hopefully your faces tomorrow in some of our other sessions.